Hello everyone, my name is Hannah DeBoer. This is my mini study analysis table. For my first study that I chose, it is titled Neonatal Outcomes of Singleton Term Breech Deliveries in Norway. The purpose of the study was to study the neonatal outcomes of planned breech vaginal births versus planned breech cesarean births in the hospital setting. The participants included 30,861 births. That included a singleton pregnancy in a breech position at term, whether they were planning on a vaginal birth or cesarean delivery. The maternal age was also taken into account as well. The planned mode of delivery was what was studied, not necessarily the end mode of the delivery. The conclusions of this study, are split up into two separate groups throughout this time period. The first set of time, 8 neonatal deaths were in a planned vaginal delivery group. 4 neonatal deaths were in the planned cesarean delivery group. That was in the first section of this study. The second timeline of the study, they found that this difference in neonatal deaths did not seem statistically significant to the authors, especially since neonatal risks seemed to greatly decline in the second period of time. The weaknesses of the study were that there was no difference between the providers who were highly trained and skilled in the birth or in a breech vaginal birth versus the providers who were not confident in their breech vaginal delivery skills, which could greatly impact the outcomes. The strengths of this study was that there was no funding for this study, hence there was probably no biasness. My second study that I chose was titled Maternal and Fetal Risks of Planned Vaginal Breech Deliveries versus Planned Cesarean Sections for Term Breech Births. The purpose of this specific study was to find the health risks of the maternal and fetal outcomes in breech vaginal deliveries versus C-section deliveries. The participants included 94,285 women. This was a big study of women that were presented with a breech presentation with a gestational age between 37 and 42 weeks. And these studies were done between the years of 2010 and 2020. The study design was that the criteria of the women had to present with a breech birth between the gestational ages of 37 and 42 weeks and pregnant with a singleton fetus. The conclusions of this particular study was that the study showed a decreased risk for poor neonatal and maternal outcomes in the C-section group than the breech vaginal birth group. The weaknesses of the studies were that the authors did not differentiate between planned C-sections and emergency C-sections. Emergency C-sections can alter both the neonatal and maternal outcomes. The strengths of the study was that it was a very large study, including the 94,285 women with the breech presentations, and also that there was no funding for this specific study. My third and last study I chose is titled Neonatal Admission Rate After Vaginal Breech Delivery. Now, the purpose of this study was to assess the rate of NICU stays in neonates who were born vaginally versus via a C-section who were also in a breech position at birth. This was a smaller study that included 482 participants. The data was collected in the University Hospital of Leipzig in Germany. The study design was that the criteria for this study, the babies had to be presenting in a breech presentation, a singleton pregnancy after 36 weeks of gestation. The conclusions of this study was that there was no differences between the NICU admissions between the vaginal delivery breech births versus the C-section breech births. Although the babies who were admitted to the NICU that were born via C-section had significantly longer NICU stays. Then the vaginally breech deliveries babies experienced a lower pH and a 5-minute APGAR score. The weaknesses of this university study was that the protocol was to perform a C-section at 39 weeks, which could also lend to possible premature infants and troubled breathing, especially if the EDD was off by a few weeks. It was a short-term study in one hospital in Germany over only 2 years. Now, the strengths of this study was that the OBs delivering the breech babies vaginally in this study were highly trained in this breech vaginal birth with a clear hospital protocols in place.